Okay, good night everyone. My name is Ahmad Rafa Muzaki from regular class, and today I will try to present about diabetes mellitus, one of the most common chronic disease in worldwide. Diabetes mellitus or DM is a metabolic disorder characterized by high blood glucose levels. This happens because the body either does not produce enough insulin or cannot use insulin effectively. Insulin is a hormone produced by the pancreas. Its main function is to help glucose move from the bloodstream into the body cells, where it's used as energy when insulin does not work properly. Glucose remains in the blood, causing hyperglycemia. Okay, so there's a three type of diabetes. The type 1 is caused by the destruction of insulin producing cells. Type 2 diabetes, which is the most common type, is mainly caused by insulin resistance. And a third type is gestational diabetes, which develops during pregnancy. If diabetes is not well controlled, it can lead to serious complications after affecting the eyes, kidneys, nerves, heart, and feet. So for the risk and factor cause, now let's see several factors increase in the risk of developing diabetes. First is family history. People with parents or siblings who have diabetes often have a higher risk. Second is obesity, overweight, or excess body fat reduce the body sensitivity to insulin. Third is physical activity. A lack of exercise makes it harder for the body to regulate blood sugar levels. Other risk factors include an unhealthy diet, a high in sugar and fat, older age, high blood pressure, high cholesterol, and history of gestational diabetes. The cause differ between the two main types of diabetes. In a type 1 diabetes, the immune system mistakenly attacks and pancreatic beta cells that produce insulin. In a type 2, the blood becomes resistant to insulin and eventually the pancreas can produce enough insulin to maintain normal blood sugar levels. So, the most common symptoms of diabetes are known as the 3Ps. The first is polyuria, which means frequent urination. The second is pilo- pol- polydipsia, or excessive thirst. And the third is polyphagia, meaning increased hunger. Other symptoms include unexplained weight loss, blurred vision, slow wound healing, numbness or tingling in the hands and feet, and recurrent infections. If these symptoms are ignored, diabetes can lead to serious complications such as diabetic foot ulcers, nerve damage, kidney disease, blindness, and even lower limb amputation. Therefore, early diagnosis and proper treatment are very important. So, let's discuss our prevention and early management. Many cases of type 2 diabetes can be prevented through a healthy lifestyle. People should eat balanced diet with more vegetables, fruits, whole grains, and lean proteins while limiting sugary foods and drinks. Regular physical activity is also important. Adults should exercise for at least 150 minutes per week. Maintaining a healthy body weight, avoiding smoking, and having regular blood glucose checkups are also recommended. For patients who already have diabetes, early management includes monitoring blood glucose level, following medical advice, taking oral medication or insulin when prescribed, and performing proper food care every day. Good food care is especially important because diabetic patients have a higher risk of developing food ulcers and infection. And finally, I will explain the role of orthotics and prosthetics in diabetes rehabilitation. Orthotics management aims to reduce pressures on feet and prevent diabetic foot ulcers. Common orthotic advice include custom outsoles, diabetic shoes, and ankle foot orthotics or EFOS, especially for patients with muscle weakness or foot drop caused by diabetic neuropathy. This device improve walking stability, reduce pain, distribute plantar pressure evenly, and lower the risk of further injury. For patients who undergo lower limb amputation due to severe diabetic complication, prosthetic rehabilitation become very important. A prosthetic helps restore walking ability, improve balance, increase independence in daily activities, and enhance overall quality of life. In addition, rehabilitation includes gait training, muscle strengthening, patient education, and regular follow-up to prevent complication in the remaining limb. So, in conclusion, diabetes mellitus is a chronic disease that requires lifelong management. Sorry. Early detection, healthy lifestyle change, proper medical treatment, and the appropriate use of orthotic prosthetic. Device can significantly reduce complication and improve patient mobility and quality of life. Thank you very much for your attention. Thank you, thank you so much for your presentation. I'm happy to answer any question. Bye bye.